the advice here in New York, no more than 10 people. Celebrate, but celebrate with your household, meaning the people who you have had in your household. Not invite over Uncle John, Aunt Nancy, Aunt Marie, they're part of my household. No, your household is who you are currently living with. And this is not a political issue. Today, this nation is so divided, more divided than it's ever been. And it's so divided politically. Everything is a political division, every issue. This is now a political symbol. How did this become a political symbol? Well, if you're a Democrat, you wear this. If you're a Republican, you don't wear this. If you're a Democrat, you support this. If you're a Republican, you don't support this. This is about public health. I don't care about your politics. I really don't care about your politics. And you don't care about mine. I care about your health. I care about if we're overwhelming our hospital system. I care about how many people die. That's what I care about. Forget the politics. It's over. The election's over. And even through the political lens, CDC is Donald Trump's administration. Donald Trump's CDC says, celebrate only with your household. That's Donald Trump. Joe Biden's COVID advisors say the exact same thing. So even if you're in this political mindset, I can't trust the other side, I can't trust Democrats, I can't trust Republicans, they both agree on this issue. Celebrate only with your household. They both agree. So even in this hyper-political moment, this is the one thing both sides agree on. And by the way, can you name one other thing that Donald Trump and Joe Biden agree on? One other thing? I can't. They both agree on this advice. So this is not a political fight. It's the one thing everybody agrees on. And the one thing everybody agrees on is this is not a normal Thanksgiving. Well, on Thanksgiving, my Uncle Joe always comes over. Yeah, I understand that. This is not a normal Thanksgiving. It wasn't a normal Labor Day. It wasn't a normal Memorial Day. It's not a normal summer. It's not a normal anything. This is not a normal Thanksgiving. And to act like it's a normal Thanksgiving is to deny reality. Of every health expert in the nation, Democrat or Republican, well, I know better. Well, then you know better than every public health expert on both sides of the aisle in the United States of America. So I don't know what to tell you, but I think that this is not a normal Thanksgiving. I think it's a special Thanksgiving. And rather than the commercialized Thanksgiving, let's think about a spiritualized Thanksgiving. And let's think about what Thanksgiving really means as a matter of principle. We have a lot to be thankful for. I mentioned the National Guard. We have a lot to be thankful for the people who we lost during COVID. The essential workers who showed up to keep us safe, who left their homes so everyone else could stay in the safety of their home. The bus drivers who showed up, the doctors who showed up, the nurses who showed up, the utility workers who showed up, many of whom died so other people could stay home. Think of how many thousands of families are celebrating Thanksgiving without a loved one this year. There are tens of thousands of families celebrating without a loved one. People who gave their life during COVID to help others. That's something to be thankful for. And remember the less fortunate. Everyone has to do their part. That's why we have this very attractive and pithy fashion statement mask that I know you are all jealous of. I can see it on your face. Don't be a turkey. Wear a mask. You know, New Yorkers, we cut to the chase. We say it as it is. Don't be a turkey. Wear a mask this Thanksgiving. Be smart. Let's get past this. Let's get through the winter. Get the vaccination done. And then the end is in sight. But we're not there yet. They say run through the tape. We have to finish it. Get through Thanksgiving. Get through the holiday season. Get through the winter. Get vaccinated. And then we'll get on with life. Don't be a turkey. Questions?
Governor, the health commissioner here in Monroe County has said that they have not contact traced a single case of COVID-19 back to a gym, a hair salon, or a barber shop. Yet today, as we go into the orange zone right here, those are the people most impacted by the new restrictions. I asked you about this on a phone call last week, and you pointed to national statistics. But I guess the understanding of the micro cluster zones was to drill down locally into what's causing the spread. If that is not causing the spread, why are these people the most impacted?
I don't know what the local health department, well, let me do it the other way. Where do they say this spread is coming from?
What you said, living room spread, small group gatherings in private homes.
Yeah. Well, every expert says the same thing. Every expert, every state, right? Democratic states, Republican states, big states, small states, Democratic experts, Republican experts. The highest rates of spread are gyms, restaurants, bars, gyms, home gatherings. The situation where you actually have the least control is home gatherings. CDC says only your household. How would you ever enforce that? I don't know. That's Donald Trump. Joe Biden says celebrate only with your household. We have a rule no more than 10. That is very, very hard to enforce. Bars, restaurants, gyms, you can enforce. Those are the four main spreaders. So what you do what you can with those four main spreaders. If that is true, what the Monroe Health Department says, that is a national anomaly. I can tell you that. Do you know, either of you guys know more than that?
I don't know what the Monroe County Health Department said specifically, but remember the approach. It's about the high-risk activities, the low-risk activities. When you're in a beauty salon getting your nails done, if you're getting your hair cut, you, by definition, can't be socially distanced. You're indoors where the air circulation isn't as great. You're in closer proximity to one another. Same thing in gyms. Obviously, when people are working out, they're breathing much more heavily. People are on machines. Hopefully, they should be socially distanced if they are following the protocols, but it's not all instances you are. And the issue is you're trying to decrease the rate of spread. When you're seeing these, when you're hitting these percentages, there's a greater chance of community spread. And so what you're trying to do is you're trying to address, as the governor said, businesses that are higher risk, that are known to cause spread of infection, because you don't necessarily know every single contact trace, every single source of infection. So those are three areas that we know from the duration of COVID that has spread. And so what you're trying to do is to stop the community spread and lower the chance that you're going to continue to cause spread. So you are closing businesses where there's a greater chance of spread by virtue of the closeness of the people that are working with one another, that are doing in-person services, or again, like in gyms where you're breathing more heavily, you're closer in contact with one another.
Inside your restrictions, they follow the restrictions that you put in place for them to reopen, which would have alleviated some of what you're talking about.
The restrictions are great, and we saw at moments through this for months and months and months that the restrictions have worked. But what you're seeing in these areas with these spikes is that there's a greater prevalence of community spread. And so when there's a greater prevalence of community spread, yes, these things are helpful, but they're not bulletproof.
Governor, I want to ask you said microcluster zones work in Erie County. The positivity rate has started to level off, but it certainly hasn't gone down since the microcluster zone was put into place there. Is it working in Erie County in your eyes? What's happening?
Well, a leveling off, when the line is going like this, and then the line changes and levels off, that is working. You're right, you'd love to see up, level, down, but level is working, right? Because that was an arrow headed straight up.
So at what point do you indicated a couple days ago that Buffalo is very close to becoming a threat. We didn't get that announcement today, but what are you looking for?
Well, we're watching the numbers. We're going to watch through this Thanksgiving season. This is where I think if we're going to get into trouble, you're going to see it a few days, 7 days after this Thanksgiving weekend. You'll start to feel the number. We're also going to be doing, we've been advised to do now a winter plan, which adds factors to the yellow, orange, red, primarily hospitalization rate. We have to prioritize hospital beds. We have to make sure we don't overwhelm hospitals and we don't go back into the emergency field hospitals. So we're going to watch the numbers over Thanksgiving. We're going to add in factors in the yellow, orange, red zones, primarily hospitalization rate, and prioritize those zones that are generating the highest hospitalization rate. And then we'll have announcements. The great fear is two things: overwhelm the hospital system and people die. Those are you want to get to the bottom line fears. Those are the fears. Overwhelm the hospital system, people die. Just going back to Monroe for a second. You had 75 people hospitalized November 4th. You went to 268. That's a 257% increase. It's one of the highest increases in the state of New York. What happened? And if they knew what was causing it, why didn't they stop it?